How many embryos would someone need for surrogacy?
It's different for everybody, but sometimes it's not how many they want, it's how many they can get. And so it's really something that we really want to focus in and have them talk to their doctor about all of that. There are a lot of agencies out there that will not take on families with just one embryo and then they're done. Because it takes so much time, energy, money to get a surrogate screened and ready for that embryo transfer. If that embryo does not take, the surrogate's disappointed, she's frustrated, and we have a large chance of losing her. So the family loses, the surrogate loses, and American Surrogacy loses. However, we are a very unique agency and we do take on these families. We try only to take on a few at a time, but yes, we do work with families with one embryo.
What if you have 2 embryos? Should you create more?
It's a great question to ask your fertility doctor. You want to find out what their success rates are on the first or second embryo transfers. Some families may wait to go through those 2 first to see if they're successful, and if not, they move toward creating more. And other families that we have worked with go through those 2 embryos while they're creating more embryos because maybe they want a larger family or have more children. We do not actually match a family until their embryos are created, because if we do that while the families are creating the embryos, we really have a surrogate sitting on the sideline waiting. And by the time you get into a match, these surrogates are very excited and anxious to kind of keep that momentum going. So we want to wait until embryos are created before we match.
Now, what if you join the agency and you're unsuccessful with creating embryos? What are your options?
So lots of different options at this stage. You can try to create more embryos. You could, if you needed an egg or a sperm donor, you can go that avenue. Or you can also do embryo donation, which is adopting embryos. So there's several different ways families can achieve a baby just based on if they can or cannot create embryos.